Thank you for joining us this evening for IFFGD's 2021 Virtual Advocacy event. Tonight, we are focusing on gastrointestinal illness in the military service member. And for this episode, we'll be talking with Dr. Mark Riddle. Dr. Riddle currently serves in dual positions as the Associate Chief of Staff for Research at the VA Sierra Nevada Healthcare System and at the University of Nevada in Reno as the Associate Dean for Clinical Research. Prior to these positions, Dr. Riddle spent 2 decades in the United States Navy with a career focused on gastrointestinal disorders and vaccine development. Thank you for being with us today, Dr. Riddle.
Thank you for having me. I'm glad to be here.
In 2020, Dr. Riddle was kind enough to write a fact sheet for IFFGD. It's entitled Functional Gastrointestinal Disorders and the Military Service Member, What You Need to Know. Can you share a little bit about yourself and a little bit about this fact sheet that you wrote?
Sure, happy to. So, thank you for the introduction, and I've spent quite a bit of time in the military prior to leaving and taking these positions, where I was learning to try to prevent acute gastrointestinal infections through vaccines and treatments and things like that. But out of that work, really discovered that, and not just me, but really found others in the field were finding that when you have an acute infection, it can lead to chronic disorders and chronic bowel disorders. And so I really became increasingly interested in trying to understand how an infection causes these chronic diseases. And so that's where I am right now, and very, very happy to be here talking to you about this topic.
Fantastic. And so what sort of GI disorders did you see when you worked with the military personnel, both veterans and active?
Yeah, so in my military career, while it was predominantly research based, and so I do a lot of research in treatment of acute gastrointestinal disorders, and so certainly saw a lot of acute infectious gastroenteritis and treated a lot of that. But out of that, I started seeing a lot of people that just didn't get better after their acute illness resolved. They didn't get better, or a couple months later, they would come back and they would be having persistent symptoms. And out of that, I started seeing and treating, and diagnosing, or trying to diagnose people with chronic intestinal disorders after acute infections. And so that's been my experience. Now at the VA, I've started up an IBS clinic. So all I see are patients that are referred to me by gastroenterology after they've been ruled out for any organic disease. They send them to me there, and I start treating them and working on improving diagnostics, as well as looking at a systematic approach to management strategies as well.
Yes, I understand that irritable bowel syndrome is very common with military personnel, both active and retired. Are there any other GI illnesses that are seen commonly in VA GI clinics?
Yeah, absolutely. I think right now the VA has a large proportion of people with liver disease, non-alcoholic hepatitis, fatty liver disease. There's a lot of esophageal disorders as well. Inflammatory bowel disease is in high rates as well. So those are, those. I think we see a lot of the same types of diseases that other gastroenterologists see, but these diseases may be different or modified in some way due to their prior being in service. And so that's So that's what I see now.
So is it true that military service members can be at higher risk for functional gastrointestinal disorders, like irritable bowel?
Yeah, absolutely. Like the definitive A-level perfectly designed study that looks at risks among military versus civilian studies have not been done, but the the overall evidence of the data show that not only does deployment increase your risk for getting these disorders, but that rates are either similar or higher than in matched civilian population. It's hard because military are these healthy, right? You have to be really healthy to get into the military, and so it's hard to compare to the general population. But then we also know that military service members are more at risk, particularly with deployment, of getting infections. And we know there's very strong evidence that infections of the gut can lead to increased risk of these disorders. But also we're learning that exposures as well, environmental exposures, can have an effect on the microbiome or other aspects of gut. And so there's probably there are and they're definitely, it's more area for study, but a number of military specific occupational exposures that could also increase your risk for having these chronic GI problems. We don't fully understand all of those, but there's a link that's there epidemiologically, or and we just study absolute risk.
So would this be the same as what is known as Gulf War veterans' medically unexplained illnesses?
That's a really good question. We're seeing that, or we saw and continue to try to understand the constellation of symptoms that have occurred after the first Gulf War and then the second Gulf War and operations in Southwest Asia. And the naming of the Gulf War illness is decades old, and the VA is kind of reframing. That naming convention still exists, but they're starting to move towards a more precise, as you call it, unexplained medical, multi-symptom unexplained disorders, because I think while that sounds, maybe more vague, it actually represents kind of what it is, and that we're seeing increased risks of multiple symptoms, of constellation of symptoms in people coming back from deployments compared to their colleagues that may not deploy, but and don't develop these chronic multi-symptom disorders. Yet we don't fully what are the mechanisms, what were the exact exposures. So when you're asking about, are these functional GI disorders the same as these multi-symptom unexplained disorders? The answer is that I certainly see patients that have a predominant symptom where they're chronic GI symptoms, but they also have other symptoms. They may have joint symptoms, or they may have other symptoms that are unexplained. We don't quite understand them. And so I would say that people, the veterans with these chronic GI disorders can fit in that umbrella, and that we certainly know in Gulf War illness, now renamed, that there's higher rates of IBS diagnoses in veterans with this Gulf War illness diagnosis. And so it's a component of it. But not all veterans with these chronic multi-symptoms have these chronic GI disorders either. So that's a complicated answer.
To a very complicated question. Thank you so much. I really appreciate you answering that. So probably the biggest question for our listeners out there today, Dr. Riddle, is what should someone do if they think they are experiencing GI symptoms, which they think might be related to their military service?
And that's a great question, and I appreciate you getting the word out. Veterans, they ought to be identifying a gastroenterologist to treat them, but I think they need to realize that many gastroenterologists are likely going to evaluate to see if they have any organic diseases, that inflammatory bowel disease, or diseases where they can actually get a solid diagnosis. And oftentimes veterans with these chronic GI disorders like IBS there's not a diagnostic. And so I think the first step is seeing your gastroenterologist. And then realizing that you're going to have to probably do some of your own homework on understanding your disease, and then talking with a team of really clinical care providers. And this would probably include a nutritionist. This could include mental behavioral health. This could include recreational therapists, in terms of increasing exercise. And there's a number of programs in the VA to try to help improve veterans' physical activity. And physical activity is an important component of sometimes in these disorders. I think there are some practices. I'm not fully aware of all the variety of practices in the VA, but there are some practices like mine where I attempt to go to that next level of diagnostics and do breath testing and things like that to really understand, to try to get an understanding of what might be underneath these symptoms that a veteran is experiencing. But the challenge is that some of these diagnostics, you may get to a diagnosis, but then there's not a treatment that is matched to that diagnosis, or there's not a treatment that's always effective. But I think if you're experiencing these chronic conditions, continue to seek care, continue to find a gastroenterologist, that manages IBS. And it's important to know that it's going to be an iterative process. There's not a single cure for it. But there are a variety of therapies that you can try in a systematic way to achieve improvement. And so I would encourage you to continue to seek care, and identify a care provider. And it may not be a GI. I think there are some internal medicine or even primary care that may be able to treat IBS patients, and continue to identify a provider that meets you where you are and continues to try to help you improve and identify treatments that work.
Thank you so much. And so you talk a little about treatments that work. Can you just really quickly talk about maybe what are some of the treatment options? I know that they're not a lot, and not all of the diagnoses have treatments, but what types of treatment buckets do you think are available, and what could people possibly think about?
Yeah, certainly. I think we often, or the guidelines often start with trying to address the predominant symptoms with medications, and whether it's constipation or diarrhea, getting a fiber component that helps with that, and taking it in the right way is important. With diarrhea, certainly, loperamide is a symptomatic treatment that, again, it's not a cure, but if taken right and taken correctly, it can really kind of reduce your symptoms. And then there's a number of other classes of medications. Some patients may have, with IBS diarrhea, may have a abnormality in their serotonin system, and so there's medications like ondansetron that are serotonin inhibitors that may help in those situations. One of the treatments that I try to rule out or rule in is the small intestinal bacteria overgrowth, and that's often identified with a breath test. And not every place offers a breath test, but if you're a veteran and you want to get diagnosed, there are community care providers that do that. We've brought the breath testing into our institution now, so we can do it in-house. And the reason that's important is if there's a breath test that shows a certain type of overgrowth, then treatment with an antibiotic such as rifaximin can really help those patients. The VA has very strict guidelines on treatment of IBS and small intestinal bacterial overgrowth, and you may get frustrated because there's an algorithm you have to follow in order to get to that rifaximin as a treatment. But if it's not difficult, it can be done. So those are some of the treatments, and then I often will, I will again, it's appreciate when you're a veteran with these disorders, it's somewhat a trial and error because we don't have a treatment that we know works in everybody. And so I'll often try peppermint oil because the evidence for that is pretty strong in certain patients with pain. And so anyway, there's a variety. And I think that the main thing is working through them systematically, where you try and then see how it works. And then I don't want to fail to mention that diet is a really important component as well. It's really important to find a nutritionist and read yourself about your relationship with food. And there's definitely certain trigger foods. There's the quantity of food. There's the type of food. So really understanding your relationship with food and how your food may increase your symptoms or change your symptoms, it's important. And so it's a lot of work, not only between the physician in trying to figure out what's going on and providing different treatments, but you also really understanding your disease and these things.
Thank you, Dr. Riddle. And just for those of you watching today, it's important to remember that this is an entire evening program. And in this program today, we will be speaking with the VA on some of their resources, and they'll be able to let you know more about being able to find those gastroenterologists, especially if you don't live close to a VA hospital or a VA gastroenterologist. And so that will be in another portion of tonight's program. If you missed it, it will be available online at the IFFGD 2021 Advocacy event page. Dr. Riddle, thank you so much for taking time out of your busy schedule to educate us a little bit more on functional gastrointestinal disorders and the military service member. We really do appreciate you taking this time with us, not only to be here today, but also in writing that fact sheet. And for anyone who would like to read Dr. Riddle's fact sheet, it is available at IFFGD's website in our resource library. If you have trouble finding it, please feel free to reach out to us at IFFGD@IFFGD.org. Thank you again for joining us for the 2021 IFFGD Advocacy event, and we hope that you enjoyed tonight's program. Thank you.